Hello, I'm Dr. Winnie King, and I'm here with some fascinating guests in the lobby of the Children's Hospital at Montefiore in New York City. Now we're going to tackle a sensitive subject that is so important. It's the question of what you need to know and do to protect your teenager from getting AIDS, even if they don't seem to fall into any of the classic risk groups. If you're watching with young children, be aware that this is going to be a frank discussion, but it could save your child's life. In the 1980s, when AIDS was new, everybody was scrambling to warn us of its dangers. Not only that, we were being told explicitly how to protect ourselves from infection. Well, today's media reports are all about treatment breakthroughs, but AIDS is still incurable, and it's teenagers who are paying a high price for our reduced emphasis on prevention. Young people between the ages of 13 and 24 today account for half of new AIDS infections in the United States. Fortunately, there are people working hard to revive the prevention message, and we have three of them here with us today. I want you to meet our special guest. We have Dr. Donna Futterman, and Dr. Futterman is a pediatrician and an expert in adolescent AIDS from Montefiore Medical Center, and she serves on numerous national advisory committees as well. Thank you so much for being here.
Thank you.
And then we have Kristen Lima, and Kristen is a mom whose daughter died of AIDS after being infected as a teenager. Now, Kristen now works with an organization called Mothers' Voices to promote AIDS awareness among parents. And thank you so much for being here with us today.
Thank you, Doctor.
And then we have our third guest, and that's Yolanda Palmer. She's a high school student who works as a peer educator and who's here to tell us how teenagers react to this very important issue. And I thank you all for being here today. This is a really, really important topic, and it's a shame that we've lost the message of prevention over the years, but it's time to get back on track. Donna, tell us what are some of the national trends that you're seeing with teenagers regarding AIDS?
Winnie, I think we can understand the issue of teens and AIDS by looking at three major trends. The first is, as you mentioned, half of all new infections are occurring among young people between 13 and 24. That's 20,000 new infections a year, over one every hour. The second trend is that for most teenagers, HIV is acquired sexually, and it's not exotic sex. It's having sex with one or two partners. For the vast majority of teens, they have no idea their partner's infected, whether that's gay boys or straight girls. They're having sex and they don't realize they're at risk. And the third trend is the continued reluctance of our society to tackle the issue of HIV and AIDS in teenagers. We expect teenagers to, if they're having sex, use condoms, but they don't see it on TV, they don't see it in the movies, they don't see it in the music videos. So a lot of people are quick to point the finger at teenagers and their denial, but I would say that HIV and AIDS prevention messages for teenagers has gotten very politicized. People want to say they can only talk about abstinence to teens. When half of teens in high school have had sex, we need to give them the skills and information to protect themselves.
Well, what about the stereotypes? You know, there's HIV infected people use drugs. They're promiscuous, you know. They're living a lifestyle that puts them at risk. Does that still play a role, do you think, in the misconceptions?
Oh, I think absolutely. Most people still think of HIV and AIDS as a disease of injection drug users, but for teens, it's not drugs that's driving it, it's really sex. And as I said, it's nothing strange. It's teens having sex in the way that they always have had sex.
Well, what about the misconceptions that teenagers have about HIV? I don't think they're even thinking about it.
I think teenagers still think they can tell by looking at someone. The favorite prevention line I hear is, I can tell by looking in his eyes. He looks clean, he looks fine. And what we're trying to give the message to teens, most people with HIV don't have any symptoms. It may be hard for them to tell you they have HIV and AIDS, so no matter who and where you're with, you have to be using condoms all the time. If you feel ready to have sex, you have to do it safely and use condoms.
Kristen, you suffered a parent's greatest loss. You lost your daughter to AIDS. Tell us about Stephanie. How old was she when you lost her?
She was 26 when she died. At 24, we were in the process of opening up new businesses, adjoining businesses. We were very excited, and she started to have problems swallowing, and I kind of thought that it was the anxiety and the pressures of all, waiting for contractors to finish things and deadlines. And she went to a couple of different doctors, and finally she had an endoscopy, and they found that she had candida in her esophagus, which indicated the presence of HIV, most possibly that it was HIV. And
that must have been devastating.
It was unbelievable. It was beyond devastating. It was like it was just unthinkable. We just couldn't imagine that it had happened, and I really considered myself to be a fairly forward-thinking, educated parent who tried to educate her child, you know, and I really did not think that that was an issue for us. I really didn't.
Well, did you know that your daughter was sexually active?
Oh, I knew she was sexually active. We went to, when we went to the gynecologist when she was, just before she was 16, I hoped she was not sexually active. And we talked about birth control, and I told her she had freedom to talk to the doctor by herself if she needed privacy, and that I would step outside. And she said no, she wanted me to be there. And she said that she was indeed sexually active, and so we did what I thought was the progressive and careful parenting thing to do. We discussed birth control, and we discussed sexually transmitted diseases to some degree, but I have to admit that the things that Donna was just talking about were part of my belief system too. You know, that it didn't happen to regular kids.
Well, now you lived in a small town in Rhode Island, nice affluent area.
Yes.
Was AIDS even on the Richter scope of possible infections?
I didn't believe it was for heterosexual contact. You know, sexual experience. I just really, I knew. I had friends, gay men, who had contracted HIV, and I was aware that people with had HIV from IV injection, but I really did not know anyone. I didn't feel that I knew anyone, and yet for many years my daughter had been living with HIV and we didn't know it.
And retrospectively now, do you all have any idea when she actually became infected? Have you been able to go back and look at that?
Yeah, actually, she was probably 17 years old, and there was, as we look back on it now, she had many symptoms that would have red flagged a test for HIV if she lived in another community, if she were a different person. By the time she was tested in 1994, when she was 24, her T-cell count was 75, so she was very far advanced, and she had full-blown AIDS on diagnosis. So
it had been going on for a while,
long time.
And unfortunately not picked up. Yolanda, you are very knowledgeable about HIV and about AIDS and teenagers. What are the things that teenagers misunderstand about AIDS?
Well, we misunderstand the stereotypes. We are a part of the society. We are the hidden part of the society. We go by what the society says. If the society is saying that it's homosexual men and people who have a lot of sex and people on drugs, a lot of teens don't fit into these categories, so they're like, well, it's not me.
And teens typically have their first sexual experience in their teen years. So this is the time when sex is really on their minds. They're thinking about sex. What is the biggest thing that they're worried about when they start having sex?
There's two worries: that their mother and father is going to find out,
right, and there's going to be a death in the family, right,
and that they're going to be pregnant.
Yeah,
those are usually the only two things I ever see.
Yeah. What does a peer educator do? That's your title, but I think most people have never actually heard that expression before. What do you do exactly?
Well, the peer educator goes out and talks to the youth. I talk to people from the ages of 13 to 21 about HIV, AIDS, risk factors, STDs, hand out condoms, and I serve as a guide to safer ways.
And so you're the one that you actually give condoms?
Yes, I do.
And do kids come to you? Do they know that you're the one that has those things? And so
they come up to me. Sometimes they'll share stories with me. They'll ask questions. Where can I get tested? A lot of people do not know. A lot of teens specifically do not know where they can go and get tested for free. I mean, we don't have a lot of money as teenagers.
Sure.
We don't know where to get tested. We're scared.
Right. Well, let me ask you, Donna and Kristen, your focus is parents. You're obviously trying to reach the teens. Parents watching the show are going to wonder, wow, I've got a teenager. What do I do? You know, what do I say? How do I even bring this subject up and get started? What would you suggest parents do?
Well, I believe that it's one of the most difficult things in the world to sit in front of your child and talk about their sexuality and their intimacy and even accept the fact that your child is ever going to be sexual. But I just say from my own experience, the difficulty of sitting there and talking to your child and being candid with them is a lot less uncomfortable than a moment where a doctor says that your child is HIV positive. Mm-hmm. So,
yeah. Chris?
And I think the other thing is the need to start early. You talk about sexuality before the young person could possibly be sexually active. And then as a parent, it's wonderful to have these conversations, but part of becoming a teenager for a child is becoming independent, and they need to get information elsewhere. And supporting the young people to look on the web, to read magazines, to ask questions of their doctor, to speak individually to their doctor, I think is also very important, because you can't do everything.
Sure, you can't. But being proactive is such a big thing that parents sometimes they sit back and wait for something to happen and then they react. But in this particular case, an HIV infection is something that you can't fix once it's there. You know, we're leaving you with a very clear message. Parents must be involved in protecting their children from becoming AIDS statistics. This literally is a matter of life and death. Now, here's a list of phone numbers you can use for additional information about AIDS. So grab a pencil as I read them. The U.S. Centers for Disease Control, CDC, the AIDS hotline. In English, it's 1-800-342-2437. In Spanish, 1-800-344-7432. Adolescent AIDS Program, 1-718-882-0322. CDC Prevention Network, 1-800-458-5231. All of these organizations also have websites. And finally, I want to thank all of my guests for being here on the show and talking about a very tough topic, and our hearts go out to you, and I so appreciate you sharing Stephanie's story, your story, to help so many other parents that are struggling and don't quite know what to do. Thanks so much for watching. See you next time.